Hi everyone, Dr. Emi from Pain Free and Fit. Today, a great exercise for those of you with degenerative disc disease, how to train legs without hurting your lower back. We're going to go over band hip squats. Hope you enjoy. So hip band squats are a great way to get a heavy leg workout in without aggravating degenerative, herniated, and bulging discs. As opposed to typical squat exercises such as barbell squats, hex bar squats, dumbbell squats, or even heavy leg presses, where you have a compression on the lower back because you have weight either above that's pushing down on the spine, or weight below that's pulling your arms down, or even the flexion component of the lower part of a leg press. Whereas the carriage comes down, the low back starts to flex or bend forward. All these typical squat exercises irritate a lot of disc problems. So many times the question comes up with patients and clients that ask me, how do I get a really good leg workout in without using weight, without decreasing the weight? I still want a lot of resistance because I want to increase mass or hypertrophy of my legs, or I want to increase strength of my legs because I know that the more strength I have in my hips and legs, the less stress there's going to be on the lower back for normal functional activities and sporting activities. How do I do that? Well, enter the exercise band hip squats. We're going to take a band. Now, the thicker the band, the more resistance. I'm going to be demonstrating using a powerlifting band. These powerlifting bands are thicker. They can provide up to hundreds of pounds of resistance. You can even use multiple bands wrapped one over each other for moving up to 800 to 1,000 pounds of resistance. So there's no one out there that's going to be saying the bands don't provide enough resistance for me. These bands are available as either cargo bands, you can go online, or you can go to a powerlifting supply place like westsidebarbell.com and order these bands. They come in various thicknesses. Obviously, the thicker, the more resistance. So the key to doing this is we're going to affix that band to a low anchor point, somewhere at about knee to ankle level. You want that angle when you wrap that band or loop it around your waist, okay? Remember, you want to loop that around your upper thighs, not into your abdomen. That way the resistance is pulling on your pelvis, not directly on your spine. You want to make sure that you have a slight angle so that your hips, the band, is higher than the floor. That way it's going to provide you resistance as you're squatting up and down. As you're coming up, you're stretching the band and increasing that resistance, just as you would with a bar on your back or with dumbbells or a hex bar in your hand. Same type of situation. You're moving against gravity with a free weight, or you're using a band to stretch it to provide that resistance. So, engage your RPI before you begin your squat. Again, if you don't know what your RPI is, that's your reverse posture isometric or neutral spine position. That's your unique body position that's going to protect your lower back. All of us are different. Everyone that suffers from any type of disc problem usually needs an RPI. No one has perfect posture. We all have different muscle asymmetries in our stabilizing muscles for our spine. We have a tendency to hip one hike up or lean our ribs to one side when resistance gets too great, or torque our bodies. These are based on postural histories and movement histories of you that aren't symmetrical. And many people need multifidus or transverse abdominis or internal external oblique correction before they do an exercise, because as resistance gets bigger with an exercise, it becomes greater, especially trying to eke out those last few reps. We're typically going to go into our old motor patterns of asymmetry. We're going to go into our strengths, which is if we're used to crossing legs and elevating one hip up or leaning more to one side, we're going to go to that, and that produces an asymmetrical force on our disc, which many times perpetuates injury and pain. So learn what your RPI is. Again, if you're not sure what that is, the painfreeandfit.com website has a free body analysis. We have previous videos on this channel on neutral spine. Learn what your corrections are that make your spine or neutral spine unique for you, and maintain that during this or any exercise. With that said, we have our neutral spine and RPI on. For me, I'm engaging my left L5 multifidus. That's my weaker one, the one prone to weakness. I'm going to make sure I keep my left hip down when I'm squatting and my left rib cage up, because my tendency when under load is to raise my left hip and to lean to the left. You only know this from a body analysis. So check yourself out, learn what that is. Also, at any of our programs on the painfreeandfit.com website, the Fast Track program for degenerative disc or the low back healing exercise program all have that analysis built into the programs. So with that engaged, we can choose our squatting style. Now, for today's example, I'm going to be using a wide stance with my feet flared out, sumo style of squatting. But you could also use a parallel hip squat where your feet are straight ahead under your hips. You could use a hip realignment squat where if you're addressing problems like external hip rotation that's aggravating your lower back and you want to use a little internal hip rotation while you squat, that's a hip realignment squat. You could do that with this band. You could even use one-legged squatting. So a lot of varieties off of this band HipThigh squat. I'm going to engage my RPI, walk away. Now, here's the big key with this exercise. The closer I am to the anchor point with the less stretch on the band, it's going to be easier for me to maintain a straight up and down squatting style, similar to what I'd be doing if I was having a barbell on my back or holding dumbbells in my hand. However, the further I stretch, that band wants to pull my hips back. And when it does so, it wants to induce flexion. Now, we already know from previous videos that flexion is going to aggravate discs because the discs are on the front of the spine. So you're using your extensor muscles to resist that. You're using your erector spinae, multifidus, glutes, hamstrings. Your whole posterior chain is resisting that flexion problem or that flexion tendency because of the band pulling. That in itself is a great way and reason to use this type of squatting. It develops that posterior chain very effectively. However, if your core isn't strong enough the further you go to be upright, you're going to find yourself leaning forward. Now, it's important when you lean forward to do your squats, if you go further away and your core isn't strong enough to maintain a vertical position, to lean forward from your ankles. I'm not going to lean forward from my waist because that's going to put more pressure on my disc. So I want to rock my whole body from my ankles, my knee, my hip, my shoulder, my ear as a straight line, but angled forward. And I can go as far as I want with that. And now my squat, if you notice, is going to be a little bit more of an angled squat. I'm pulling in line, more in line that is, with the band's resistance. Again, if I've developed a really strong core, the further away I go, I can maintain more of an upright posture. However, I need a really strong core. So, depending on your development with your unique back situation, if your core isn't strong enough to hold yourself upright, the more that resistance goes, but you still want the load on your legs for a workout for hypertrophy or strength, then use that angle technique. And as I said, you can use up to hundreds and hundreds of pounds of resistance depending on what thickness band you use with this exercise. If you like this video on hip band thigh squats, feel free to subscribe to our channel. We've got a lot of great videos out there for degenerative discs, herniated discs, and bulging discs. Looking for a great program to figure out how to heal your disc problem through healing exercises, how to self-rehab and self-manage your pain and get back into working out heavy without hurting yourself? Check out our Fast Track program available at painfreeandfit.com for degenerative discs. It's got all the exercises, body analysis, program design methods for you to get back into shape without hurting your back. I hope this video on band thigh squats helps you with your degenerative disc, herniated disc, and bulging disc fitness issues.